The information contained on this platform represents the opinion of the host and shall not be understood, construed as, or a substitute for medical or health advice. Please see a health professional who is aware of the facts and circumstances of your individual situation.
What's good, 365ers? My name is Britt Daniels, your fit life coach, yogi, and entrepreneur, your co-host of the Black Health 365. And as y'all know, it is our mission to be champions of truth and change by providing y'all with personalized healthcare information and resources from trusted professionals. It is our mission, again, to empower the Black community to make healthier choices all year long. And I'm joined by my beautiful co-host.
Hi, everybody. Jackie Page, radio personality and fitness enthusiast. And I'm just going to leave it at that today because I think that pretty much covers everything. Bri, how you doing today?
Today, I'm in a process of healing. Recently was in a relationship and it ended on cordial terms, necessary terms. It was just a situation where we just realized there was no compromise to be had and we had to step away from each other. But in this process of healing, I'm actually proud of myself because this was much less toxic than some other breakups. So I'm happy that I can walk away with getting something out of it. And yeah, being a little bit more emotionally resilient. I know that was a lot to drop on you, Jackie. Just to start.
Very much so, because the last time we talked, everything seemed to be copacetic and peaches and fairy tales and 365ers. The same way you're just now hearing about this is the same way I'm just now hearing about this. So I'm just like, oh, what? But I am happy to hear that, as you said, things were amicable and it wasn't like a completely crazy situation, because I feel like I've dealt with a lot of those.
Yeah, I think as we get older, or, you know, the energy that we put out in whatever space and season we are in our lives, we have people gravitate towards us based on that energy. And, you know, luckily I was in a space where the energy I put out wasn't something that was inherently toxic. You know, it was some issues, but it wasn't inherently toxic. So I take pride in that and just, you know, just working on moving forward from there.
I like it. I'm happy to hear that everything is okay. Mentally, how are you feeling about the breakup? Are you like, okay, like you good?
Well, I'm excited for this conversation today, Jackie. We're going to talk a bit about depression today. And on previous podcasts, I had spoken on how I was feeling some emotions. I was feeling depressed. Coming back from a long spiritual vacation in Japan, back to running my 3 businesses, basically I went from serenity to burnout. In that process and that overload, I felt like felt scattered because I was out of routine. We're going to talk a little bit about this more, but that coupled with this, I'm in an emotional, interesting space right now, right? Mm-hmm. But I do feel, as of today, I would say as of this week, a bit more emotionally resilient because I'm sticking to my routines. I'm doing the things I know that are necessary for my mind: meditation, working out, eating right, chatting and connecting with friends. So we're doing the things we need to. I appreciate you asking.
You know, that's what I got to do. I got to ask. I got to make sure you're good. And we actually have a clinical social worker, Dara Grimes. She is joining us today on the Black Health 365 podcast to talk about depression. So I know she's going to be, you know, a great tool for you right now in this time that you're going through, Britt. So, you know, I had to ask. Really quickly, Dara, how are you doing?
I'm doing well. Thank you for asking. And I'm glad to be here and hopefully can provide some information and some support on this series, on this episode. So
really excited to have you. Thank you for joining. Britt, before we hop into the conversation about depression with Dara, can you drop a Dharma talk on us real quick?
I'm excited to do this finally on camera, so 365ers can see my face as we drop this knowledge. So 365ers, as you know, we start off our podcast with a Dharma talk. A Dharma talk comes from the Eastern tradition. It's essentially a small sermon just to set the tone for the conversation. In today's Dharma talk, speaking from the concept of, we're going to talk about depression. Today, we're going to talk about empathy. Right? Empathy is the ability to understand and share the feelings of others. It goes beyond sympathy, right? Which is merely feeling sorry for someone else. Empathy allows us to truly connect with others, acknowledging their experiences and offering support and understanding without judgment. When we practice empathy, we open ourselves to profound interconnectedness with everybody around us and understand that we're not alone in our own struggles. And in that process, we create a community of people who want to tap in with each other. And that's important because everybody, Jackie, is going through something, and that doesn't excuse you for certain behaviors. But it's important that we step outside of our own selves to see other people's perspectives so that we connect with them and so that people can heal together. As we've been saying on multiple different podcasts, healing is a verb and it takes time, right? It takes communication. And so as we talk more in this podcast, I hope 365ers, as you're listening to this, if you know someone that is struggling with depression, if you yourself may feel like you have some symptoms of depression, give yourself grace, show yourself empathy, because there are tools that can help you feel reconnected. No matter how disconnected you feel, there are tools that help you feel reconnected.
Powerful Dharma talk today. Thank you so much, Britt. And I know that was, I'm not going to say it was hard for you to do, but I know that was, that took some courage and some strength, especially considering what you've been through. And we've all heard your story. And then, where you're at right now, actually having to come forward and share those emotions and walk through that it can be challenging. So, as a friend, and I'm sure the 365ers feel the same way. Thank you for giving us that because, that's not the easiest thing to do. As I was saying earlier, we do have clinical social worker, Dara Grimes, hopping on to talk with us about depression. It is something that is hitting the Black community, I think, a lot more than it's hitting in a lot of other communities. It's going undiagnosed. And it's something that we need to discuss. May is Mental Health Awareness Month. We've seen on the news and in social media that there are a lot of celebrities and just people in general who've been dealing with depression. And it's something that a lot of people didn't know about. So we definitely want to talk about it today. Dara, I have a question for you. Being a clinical social worker is not an easy thing to do. Why did you decide to step into this profession?
Well, I think it chose me. My mother is a clinical social worker, and I kind of grew up kind of seeing how she helped other people, and I kind of just fell into it. I was always in the helping profession somehow. And I like helping people, and I try to empower them, not to do it for them, but to teach them to do how to do things, and so they can do it themselves. So especially for our people, I like to work with Black people and people in our community to help them do better, because we are kind of afraid to step out there and say, hey, I'm struggling. I don't know what to do. I need help. And so trying to create that space for people to feel comfortable, to not have to explain their experience because we have a shared experience that we understand. They don't have to tell their whole story, and we can kind of get into the things that they really need to resolve and work on. So I think that's part of the reason how I kind of fell into this profession.
That's beautiful. You said a very concrete thing about finding ways to help people hold space for them to express, for them to navigate emotionally what they're going through. And that's really powerful. From the highest level, from a global level, what is the clinical definition of depression?
So basically, the clinical definition of depression is a mood disorder, that causes like a pervasive or persistent feeling of sadness, or just feeling low or loss of interest in pleasurable things that you like to do, before. And a lot of times it impacts your daily life functioning. So, it impacts your ability to get out of bed or wanting to get out of bed, self-care, taking a bath, shower, brushing your teeth, cooking, those basic everyday things that sometimes we struggle with. And in its mild form, it just may seem like, oh, I just kind of feel kind of melancholy today, And its most moderate to severe form, I don't get out of bed. I'm not bathing. I'm not lifing. I'm not taking care of myself. And so that's when you know that it's a problem, because it's affecting your ability to do your life, every day, to do life.
So often we as Black people like to sweep stuff under the rug. So, me feeling like, oh, I'm just tired today, or oh, I just don't have the energy today, or I don't have the energy this week. It's just a normal thing. At what point in time do I know that I am suffering or that I may be dealing with depression?
Well, I mean, depression is different, experienced differently for everybody. It's different. So, you might be like, well, I'm noticing that I usually get up at 5 o'clock in the morning with no problem, and I'm up and I'm running and I'm exercising, I'm doing things. And you're like, I'm not doing it. And you're not doing those things. The things that you used to do and that you enjoy doing, you're not doing. That you have pervasive, thoughts of sadness or thoughts of suicide or just thinking like, I just don't want to be alive anymore. Your appetite often can change, or you're eating too much or not enough. Your sleep is impacted. You may be experiencing insomnia or hyposomnia, like you're sleeping too much. Or you might be able to fall asleep, but you're not staying asleep. You're frequently waking through the night. And then when you do wake up, you're feeling tired. There are a lot of things, or in men, especially, irritability is a sign of depression and frustration, which is I'm not saying that women don't become frustrated and irritable, because we can, but a lot of times in men, it shows up as anger and frustration, and so that's kind of how it's like, this is not my normal self. And sometimes you just need a little downtime and you can rebound. And sometimes you're like, okay, I haven't rebounded in a week. So this is probably an issue that, requires more professional support and intervention.
You highlighted a lot of excellent points, symptoms of depression, expressions of it. I can definitely speak from my personal experience as a Black male who didn't have a lot of therapeutic resources growing up to understand my mind, didn't have a language for vulnerability, that my depression in my early 20s and my teenage years manifested as aggression, as violence. I felt like someone stepped on my shoes. I had to respond and react. And in healing, I learned that, no, that's not necessary, right? And so for any of my brothers hearing this right now, if you're going through a period in your life where you're feeling irritable, feeling angry all the time, there might be some deeper reasons behind all that.
Absolutely.
Britt, when you were going through your depression, did you know that like the anger and the irritability was actually depression? Or did you just think that it was like, I'm just irritable and I'm angry? Like, did you actually identify like, hey, I think I may be going through a bout of depression here, like something isn't right?
This is back in, we're going back talking about my issues with drug abuse, my early 20s. Back then, Britt didn't have a language again for vulnerability or a language for understanding the complexities of the human mind. Depression, I've heard of it, but in the Black community, do we talk about depression like that? You might say that's what white people deal with, and so no, I didn't at first have an understanding of it. It was just kind of a mentality, me against the world, like everybody out against me. I felt like I had my ribs touching my rib. I felt like my ribs were against my skin. I felt like a caged animal. And all I could do was react because I didn't have a language to communicate. And I think a lot of people feel like that. They feel like they're backing up against the wall mentally and against the world. And it just come out as anger.
Dara, if you know somebody that's going through this, and I feel like we see it a lot, we just don't have I think what Britt was saying, like the words to communicate with them. Like, how do you have this conversation with somebody like, okay, I see something's off. I feel like you may be depressed. How do I say something to a friend or a family member without making the situation worse?
So for me, I just directly just ask the person, acknowledging, saying, I'm noticing that, I haven't heard from you in a couple of days, or when we talk, you seem short, or you seem like you just scattered, or you're all over the place. And I'm just noticing that you're just not yourself, and just say very directly, like, I'm concerned. And is there something you want to talk about, or, something I can help you with, or something like that? I think just the direct approach is always the best, because I think we as Black people, sometimes we kind of feel like we have to be strong and we have to hide that everything's okay. And it's really not. And you're like, no, it's really not. And there's help out there, for us and for other people. So I would just say, just ask.
I'm interested. Obviously, depression has so many compound effects on our mind, which leads to how we speak, how we think, how we interact with people in our lives. As a personal trainer, as a yogi, Jackie, as a wellness instructor as well, I think we can speak for both of us and ask, how does depression affect the body?
Well, it affects the body in many ways, and especially for Black people. So if you have a pre-existing condition like diabetes and, thyroidism or some of the heart disease and things like that, when you are depressed, and it's, like I said, depression is like a prolonged or persistent state of symptoms and behaviors, and they go unchecked. If you don't have heart disease, and it will become heart disease. Stress is the number one killer, and it also can affect, cause some types of cancers. Diabetes, heart disease, I said, cancer, stroke, and other neurological disorders. So they do affect us physically. You can develop medical conditions, or if you already have those medical conditions, they can become exacerbated by depression and not being treated.
So do you think, because women, there are certain groups of people who are I don't want to say underdiagnosed, I don't want to say misdiagnosed. But do you think some of these chronic issues that we deal with is part of the reasons why why we're underdiagnosed, because we're going in for like high blood pressure versus going in via depression? Like, I kind of want to know why we women, new moms, elderly people, why there's always that stigma of like, we're never diagnosed the way we need to be. It's always something else, and it's never depression. We always want to just push it off to something else.
Well, I think also it's not just us, it's the providers that we're going to. A lot of times they're just not educated in the things that affect Black people. They don't live in the communities that we live in. They don't experience the same type of the microaggressions, the, systemic racism that we experience. So you go in, you're like, oh, I don't feel well. And they're like, okay, what's wrong? And they ask, it's like, okay, you have diabetes. But there are other things that are tied to that. It's like, okay, so are you teaching me how to manage my diabetes? Is there a way that I can not, develop, heart disease, or does it lead to other things? How can I mitigate these things? They don't think about the mental health piece, because it's like, oh, well, you're used to it. You just give you some medicine or tell you what to do and you move on. They're not really looking to really help you become a whole person, to know how to heal yourself and to seek help. So it is a problem in our community, going to doctors. A lot of times we don't go to doctors. I understand why. I do get why we don't go. And then once you're going to, they're not, like I said, well-versed in the things that affect Black people.
That's a lot to take in. It's always, I don't know. I get really like in my feelings when, we have these type of conversations, because you would think that the healthcare system would do a better job. You would think that the healthcare system would care a little bit more, especially in 2023. And that's not the case. And it's sad because it is 2023, and it just kind of puts you in a position of like, what am I supposed to do? Who am I supposed to talk to? Who am I supposed to go to if the people that are supposed to help me aren't here to help me?
It is a problem. It is a serious problem. And so when, as a mental health care professional, it's like saying, okay, yeah, you need to go to your primary care doctor, or you need to see a psychologist, or you need to see a psychiatrist. But sometimes it's hard for me to even make that recommendation, because I know oftentimes, depending on who they go to, that they're going to walk away feeling probably more frustrated than they did going in. So I would say, really look for people who look like you, also has shared experiences, and also have the, educational credentials to be able to treat the whole person and not just one condition, because they're all intertwined and they're linked. And someone's going to teach you, to educate you and to do better. So that's part of the issue that we have too in this community.
If I am looking for a mental health provider, what would be some of your suggestions of things that I need to, I guess, consider or think about? One, before I get to, sitting down to talk to somebody, and then what happens once I get there?
Sure. So I refer people to psychology.com, and you can go and you can filter for different providers based on your area. So you put your zip code in. You can look for, say, okay, I'm looking for someone who treats depression or specializes in treating depression or anxiety or what have you. And you put in your filters according to your insurance, whether you want a male or female, black, whatever you're looking for, you can filter for pretty much anything. You can read their bios, you can see their picture, you can see if they're accepting new patients, and you can contact them directly. And you can have a conversation. A lot of providers provide like 15-minute free consultations, so you don't have to commit to being with someone, because therapy is a relationship. And sometimes it doesn't work. It's just like in all relationships, it's just not vibing. And it's okay to leave and try something else. So I tell people to do their due diligence and actually go to these sites and read the bios, request a free consultation, and ask questions.
That's important. Just touching on some of the things you said, and also, again, speaking from personal experience, I have been in a seat across from someone who did not share my skin color, and I did not feel understood. And that had such a negative experience. That negative experience had such an impact on my perception of clinical help that I felt like coming out of it, I need to do everything on my own. I need to figure out how to get my life together. So I stepped into a place where I got to read every self-help book there is. I'm going to tap into just working out extremely hard and doing everything that's necessary to build myself up. But we aren't islands to ourselves. We are social creatures, and therapy is important. And healing, I have come to understand that. And healing, I have come to understand that you need that mirror of consciousness to sometimes help you. When you seek advice, no one knows your life better than you. But I think when we seek advice, we aim to get different perspectives around this experience here in this world. And so that's really powerful. I come from a family, Albany, Georgia, deep down south, birthplace of Ray Charles. A lot of people struggle with a lot of ailments in my community. I love how you said you got to address the whole. In my education, I call that cures personalis, addressing the whole. A lot of people where I'm from didn't have the resources, didn't know how to tap in like this. And depression is rampant, and it manifests in so many different ways. My question is depression in some way, shape, or form hereditary?
It can be. So there's plenty of studies on this topic, whether it's hereditary or not. And they say about 40 to 50% of people who have experienced depression, they have a family history of depression. Oftentimes it's undiagnosed. You just know you had that aunt or that uncle is like, they were always a certain way, and you're like, but they were never diagnosed. And so 50 or 40% of it can be hereditary, but the other part is physical conditions or other factors. But really the short answer is they don't really know, how much of it is hereditary, if it's, what part of it is hereditary, is it 100% hereditary or what? So they're really still trying to study that to see, but I believe that, yes, there are some genetic correlations to depression. That's why they always ask for your family history. So if you've ever been to a therapist, oftentimes if they do a very thorough intake, they want to know about your family history, because it does play a part in how you are, perform and how you go through life today. And can it really kind of unlock a lot of mysteries for yourself if you know what your family history, especially mental health history, not just medical, but the mental health history is important.
For sure. That kind of gets us into like the biochemistry somewhat. Some people, they may just say my neurochemistry is off. We get into bipolarism, we get into ADHD. Personally, I have ADHD. And in educating myself and through dialogue with healthcare professionals, I realized a lot of my depression in my earlier years came from undiagnosed ADHD, because I feel like the way my brain works, if I get overwhelmed and I don't have a system of routine, it feels like the world is weighing heavy on me. And so I in conversation with a lot of friends who have it, ADHD as well. They express that as well. Untreated ADHD can be depression. With that being said, are there other types of depression, like seasonal depression, or like some other terms that we have out there in the world that people kind of use that you're aware of?
Sure. So there, bipolar depression. I think most people are really starting to learn more about bipolar depression, seasonal affective disorders, which you're talking about. Major depressive disorder is which people say, well, I have depression. Usually that's what they're talking about is major depressive disorder, which there are 3 levels or specifiers, which would be mild, moderate, or severe. And there's postpartum depression, which a lot of women go, and that's undiagnosed or misdiagnosed a lot of times in Black women. Postpartum is a real thing. And so there's premenstrual dysphoric disorder. So those are the most common types of depression.
Does depression only affect adults? Is it something that like children can deal with? I know we hear a lot about like, teenagers, young adults, and then also the elderly, but I mean, can it affect toddlers and those that are under the age of, let's say, 12?
Oh, yes, definitely. I treat children and adolescents as well. So you do see a lot of depressive symptoms and behaviors in children and adolescents. Sometimes it's maybe not enough to become a formal diagnosis, but it's mostly, symptoms and behaviors that kind of, I guess, mimic what, diagnose what depression is. So yes, to answer your question, yes, children can be depressed. Yeah, especially in our community because of trauma. A lot of in adults, children, and adolescents and the elderly. So there is a correlation between trauma and the Black community and depression.
So for any of the 365ers that are listening and they may have a child that they think may be going through, I guess, let's say depression, what are some things that they need to look out for? I know you said trauma. Britt just mentioned, he dealt with ADHD. Is there anything else that a parent should look out for to say like, hey, you know what, maybe I do need to have my child go sit down and talk to somebody because they may be dealing with depression?
Changes in behavior. A lot of kids, sometimes they don't have the words to say, I feel sad, or I don't, I'm just angry. A lot of times you see children acting out. They're angry. They're frustrated because they don't have the words to speak. Just if they've experienced any changes in their lives, like grief, a loss of a parent, a loved one, or a pet, or anything like that, and they just notice that the child is different. They're not wanting to get up, or not eating, sleeping too much, acting out in school, and you're getting more calls from teachers and saying, something's going on. They're sleeping in class. There's a lot of things that they need to look out for, and just don't brush it off like, oh, that's just them acting out. There's a reason for behavior. People just don't act out or are sad for no reason. There's always an underlying reason as to why we are acting or behaving the way that we're behaving.
We just went through an incredibly difficult pandemic, especially during quarantine. Something we haven't, it was unprecedented in the world's experience. In your work dealing with depression, what do you feel like, and with other mental health issues perhaps, what do you feel like has changed in the world, in your profession at least?
Since the pandemic?
Yes.
A lot. People are just overall just not doing well. I've seen more people have completed suicide. There have been more referrals, at least for me in my practice, that I can't even accept. People are coming saying, I'm just having a hard time kind of dealing with life after the pandemic, but we're still in it, in a way. It's just that people just don't see it the same way. But losing jobs, losing loved ones during the pandemic, and just not being able to manage the feelings and thoughts that they have. And they're just not doing, overall, we're not doing well. As a whole, we're just not doing well. And we don't know what to do about it. But I do see that more people are seeking help for it.
That's big. I agree. Working as a yogi, as a personal trainer, as someone who operates in the healing space, I do think in the Black community particularly, there has been a shift towards health awareness, mental health awareness, where it's not as much as a stigma as it used to be. It's more okay to go to a therapist. It's more okay to go take a yoga class and try breathing techniques. In my experience, I've seen that more. And so I think definitely a lot of people are still struggling with the remnants of the pandemic. But I do think there has been a somewhat of I won't say spiritual shift, but an awareness, which is good to hear. Well, me and Jack are interested in this. We talked a lot about what depression is, how it manifests, how it affects the community. In your profession, in your line of work, how do you help treat people with depression? I want to say cure, but what are some strategies?
Okay, so there's no cure for depression. However, it can be treated. And so usually when I meet with people, I do behavioral health screeners just to kind of see where you are in the severity of your symptoms. And then I just follow up with a clinical interview, which is basically just a conversation and asking questions about your past and what you're experiencing right now. And usually the intervention that I use is cognitive behavioral therapy, talk therapy. I'm not a proponent for medication necessarily. However, I would say if you need it, you take it, to kind of help manage the symptoms of your depression. And since it doesn't have to be a lifelong thing that you have to take forever, but if it gets you to a place where you're able to receive information in therapy, that you can actually do the work in therapy, then that does help. So that's the best practice, is really medication management and therapy.
We do a thing called What's Your 365? And it's like a tidbit of information that we like to leave with the 365ers. I was having a conversation with another therapist earlier today on my radio show. And one of the things that she said that really stuck out to me is that when you sit down and you talk to somebody, you have to be willing to do it. So if somebody isn't ready to make the step to sit down and see a clinical psychologist, psychiatrist, or a therapist, what advice or what tips would you give somebody as far as managing until they get to the point where they are ready?
So you're right. If you're not ready, you're not going to receive the information. I would just say, as a friend or whomever, just to talk to them and just encourage them to talk. And usually they'll arrive at the conclusion that I need to go talk to someone, and then just encourage them to do so. But to force someone into seeking help never really works. So they have to be ready.
Yeah, thank you so much for one, co-signing on that, but then also sharing that snippet of information, because like you said, they have to be ready. You can't force somebody. They have to be ready to receive it. Dara, thank you so much for sitting down and talking with me and Britt about depression. It's something, like I said earlier, that we in the Black community that we deal with. Women, we deal with it. Men are dealing with it. Children, I think we just realized that everybody, no matter what age, in some way, shape, or form, you're dealing with it. If people want to reach out to you, whether it be via email, your website, or social media, how can they do that?
Sure. So they can visit me at abettermind.com. That's the website. And then my email address is Dara, D Grimes, Grimes, at abetterme.com.
365ers. If you know somebody that is dealing with depression, or if it's you, Dara is here to talk to you. She is here to help you. So please, please, please reach out. As always, if you have anything that you want us to cover, you can hit me and Britt up on social media at Black Health 365. That's Instagram. Slide on them DMs. You can find me at Love Jackie Page.
And you can find me at prophetfitness.life. Again, 365ers, it is your responsibility to be an advocate for your health. And speaking on today's topic, hold space for others to heal. Peace, namaste, and love.